All right, Edward, you just wrapped up your AlmaTED treatment. How was it?
It was fine. I kind of dozed off. The humming of the machine, there was no pain. Yeah, I kind of dozed off a bit.
Awesome. Yeah, so we harvested your blood, injected some growth factors up there, drove them with sound energy. So, so would you describe it as a scalp massage, or how would you describe the overall process?
Yeah, like a spa, like a massage. Yeah, absolutely. Awesome. Like I said, I just kind of, the humming of the noise, I kind of just dozed off a bit.
Good deal. Awesome, man. Well, glad you enjoyed it. Thanks for coming. I know you're a patient, Dr. Coles. Wanted to ask you when was your first procedure? Do you recall?
You know, it's funny. I was having a hard time, and I had to look at my paperwork. But yeah, it was 12 years ago. 12 years ago. Yeah.
Yeah, so you did a strip back prior to that.
Yes, which was a nightmare.
Yeah.
It was a nightmare. Yeah. So I started losing my hair maybe in my mid-20s. Mm-hmm. You know, so I kind of panicked. And I just found the first hair surgeon in Tampa, actually, and they did a strip and the doll plug hairs, you know. So that was okay. It gave me a little hair, but as I lost my hair, my hair was getting worse because it was looking faker and faker, you know. And I had a huge scar on the back of my head because at one point I was like, I'll just shave it, you know, just give up the fight, and I couldn't. Or at least I thought I couldn't, because I had this giant scar with lines like that, like almost like train tracks. Right. You know? So I wore a hat for like 10 years, you know? Or I would comb my hair in a weird way. And, you know, so then I finally said, you know what? It was about 13 years ago. I was like, you know what? I'm going to do my research this time. Got a little older, you know? So found Dr. Cole. Got the procedure, and yeah, like I said, I love my hair, you know, like people can't tell, you know, and I went from stressing and wearing hats all the time to one of my best features has been my hair, and it's been 13 years, you know. I take finasteride, but that's it, you know.
Nice. So as far as your the initial procedure we did with you was just kind of building out in front of those bigger grafts, or do we remove some?
Well, no, he did. Half of it was filling, and the other half was repair. So what he did was he took grafts because I wanted that scar covered. Mm-hmm. It just bothered me. So he filled that scar, and then the other transplant doctors went too low. So as my hair receded, I had it went like almost in an angle here. So he removed a bunch of hair here, gave me more of a natural hairline, and then filled in the other areas. Yeah.
Yeah, and it's been 12 years, and would you still say you have a natural looking hairline for someone your age?
Yeah, I think so. You know, I still get, you know, because now I'm getting older, my hair's getting whiter, and people are like, oh, you're lucky. You know what I mean? Like, oh, you're lucky. You're one of the guys that aren't losing their hair. And I just kind of chuckle, you know, like, yeah. You know, because for 10 years, it kind of dictated my life, or a big part of it, you know. So. Well,
I knew you were wearing a hat all the time. How else did it impact your life? Did you not want to go to social events?
Yeah, you know, I would worry about the weather. You know, I just wasn't confident. You know what I mean? Like, I always thought, and it was my own perceptions, but I always thought people were looking at my hair, you know, made me feel, I don't know, weak almost, you know. And looking back, maybe that's silly, but I feel great now. You know what I mean? And I don't think about it. It's something that I don't think about anymore. You know what I mean? So.
My versus, I'm sure you think about it every day during that time frame, right? Like,
Yeah.
Is the wind gonna blow wrong? Like you're saying, right?
Yeah. Well, is it appropriate to wear a hat at a wedding?
Mm-hmm.
I'm gonna. You know what I mean? Like a baseball cap so yeah. And it's funny, like I said, even now, like as my hair turning white, you know, my wife's like, "Oh, do you want to like dye it black?" I'm like, "No, I like it just the way it is." Yeah.
It looks good. It looks really good.
Yeah, I like it.
Now, so I know you said you did a strip score repair. Have you, as far as the repair work goes on that, what's the lowest you cut your hair without it being visible?
2.
A 2 guard?
Yeah.
Nice. So we only did one pass on it? We only grafted into it one time?
Yeah.
Nice.
So.
Very good. Awesome, man. I know you're here today to do some regenerative medicine. We're going to do a CRP treatment. That's fantastic. It's going to kind of give you just kind of a boost as an anti-aging, keeps everything in the growing phase for a long period of time.
Yeah, I'm excited about it. My hair, after 12 years, it still looks good, but it's getting a little thin. So I've heard great things about it. So I'm really looking forward to it.
Now, as far as the grafts, you know, do you notice that you still have a lot of hair in the front? Have you noticed some of the grafts thin out over time, over the past 12 years?
The grafts themselves?
Yeah. No, just native hair?
Yeah. They're rock solid. You know, when he did the procedure, he focused on the mid and repairing the hairline. And as you can see, that's good. I'm starting to go a little thin in the back, but at the time, I didn't really need much then. So, but I mean, his work has been, yeah.
And you still on Gentle 1 milligram Propecia?
Yeah, finasteride.
Finasteride?
Yeah.
Okay. Are you taking orally or topically?
Orally.
Okay.
Yeah.
Are you doing minoxidil?
No, I get lazy with it. I just get lazy with it.
Yeah, it's a bit of acid treatments.
Yeah.
You take any supplements?
I take a multivitamin and some fiber.
You work out regularly?
Yes. Yeah.
A lot of protein?
Yeah. I'll take protein shakes. You know. Yeah. I try to eat clean. You know.
Good.
Red meats.
Red meats?
Yeah.
Good. Any fish oil in your diet?
No. Like I said, I'll multivitamin and just eat healthy.
Good.
Yeah.
Now, diet's play an important role.
Yeah.
There's guys that they go undergo bariatric surgery, and next thing you know, they're not getting enough protein in their body. And the body starts diverting proteins from different organs to like the kidneys, heart, so the hair will start to fall out. So eating a balanced diet is really good. And exercise is great; increases your blood flow throughout your entire body.
Yeah, I always try to stay active. You know, like I said, I live in Florida, so it's always decent weather. You know, in the summer it gets a little hot, but then I'll just do something in the mornings. Yeah.
Well, 12 years and haven't had a comeback since, so.
Yeah. Right.
Glad you're here today, but it all looks pretty good right now.
Yeah. Thanks.
Awesome. I think we're all set. I appreciate your time, sir.
No problem.
That's good. So looking at your hair mass, you know, just with a treatment in December, and it's down, we're like 6 months after you treated.
Yeah.
Right?
Yeah.
You've got, I was telling you, you got over 50% increase in mass, but we kind of went back and reevaluated. It's like you got 100% increase.
Yeah.
And that's kind of what we want. We're after. Yeah, you're. I mean, you went from 15, you tripled here.
Yeah. I noticed the first month, right off the bat, like the first month, you know, and I was skeptical. And like I said, I had an independent witness. My wife was saying, "Your hair's getting thicker." And I'm like, "Stop it." But it's undeniable now.
Yeah. Well, you know, when you evaluate hair mass, I always like to do that on people because I can spot hair loss before they can see it. Like your donor area is a 98, which is off the chart high. You know, average is around the 70. You're 98. That means you got more hair density, or you got higher diameter, or you got both. Usually it's because you have a better than average diameter and better than average density. So that's great. And when we compare that to everything else, every other part on your head from front to crown is lower. So it means that you're going to lose your hair all over the top of your head, and you were well on your way. You know, you were like 60% of your hair mass was gone in the front, and in the crown it was like, you were just holding on to around 10% of what you had. Now your crown is up over you had lost maybe 90% of your hair here. Now it's like 40%.
That's
In
amazing.
the crown.
That's okay.
So you're going in the opposite direction, and we're able to track it, and that's what we're doing. We're looking at regenerative medicine as a whole. So in longevity, if you study it and you start looking at people like David Sinclair and Dr. Attia, who are talking about prolonging life, what we've done literally since the 1940s is we've increased lifespan from about age 50, you're going to die in your 50s, to now it's in your 80s or 90s. And it doesn't mean you're going to make it, but chances are much better that you will. Unfortunately, with certain organs, we're not doing very good. We're not able to prolong the life of let's say, the brain. So people are living 10 years with Alzheimer's, right? We've done a great job with heart disease. You know, we're doing good with some cancers like colon cancer, spotting it early, and that's what we have to do because we have not really improved treatment. So it's catching it early, but we're not really turning back the clock. We're not really making people go in the opposite direction. We're just kind of keeping them alive longer. Some of that's through enough food. You know, there were bad sources of food for many, especially many populations for a long time. There was dirty water and stuff like that was killing people. It was better modern medicine. It was keeping people alive. Keeping babies alive better. But turning back your chromosome life is really the sign that what we're after. Like, can we make your telomeres longer? And what's happening with your hair is you're going the opposite direction. You're getting younger on top of your head. And that is the long-term solution. I mean, we can transplant till we're blue in the face, but if you keep getting older, we're going to run out of hair. And to move. And so we like to catch people before they lose their hair. And then we can, we got a better shot at this regenerative medicine, but also we might avoid the transplant.
It's amazing because, 20 years ago, none of this was available. I remember my first hair transplant was because you were one of the only people doing the follicle, the FUE.
The FUE,
you were one of the very few, and you were pioneering it, And now it's crazy how, like I said, I'm getting denser hair. Would have never thought with a non-surgical procedure.
Transplant. So you had a transplant, but you didn't have this.
No.
Now you got this plus, we added some. Hey, transplant's a sure bet. Sometimes with regenerative medicine, it doesn't work quite as well as we like, or people are in denial. If you start treating hair loss before it's visible, you're going to look the same. It may feel thicker. You may feel like you got more hair there, but you're going to look the same. So you've got to wait until somebody's really showing signs of being bald, and then turn back the clock before they say, oh yeah, it's really working. It's kind of like if I sent you to the gym and you worked out every day and you never got any better, would you keep going? If you didn't get a six-pack, would you keep doing sit-ups? And watching what you eat? No. So if somebody comes soon, that's when they're going to have the best response. That's when we can turn back the clock the best. But they feel like they look the same. Sometimes they got to come in and we weigh the hairs, put them on the scale and say, yeah, you gained 10 pounds of muscle mass.
Yeah.
You know,
Yeah.
even though you look the same, you got 10 pounds more muscle mass.
Yeah, I've been telling, because I have 3 boys, and I've been telling them, start the finasteride once you start seeing, you know. And one of my boys, he's starting to lose it, and you know, I'm like, prevention is way better.
Yeah.
You know.
Yeah, well, we have people come in for transplants and we can see it,
Yeah.
okay? Like they'll be bare here.
Yeah.
And we're like, okay, I want to build my hairline really low. And I say, well, we got first check and see what's going on in the rest of your head. And so when I do my evaluation, like we did when you came in December, and then after, you know, we did the TED and CRP, we evaluated your response, but in multiple locations and compared it to the donor area. Now, you were too short when you came in here in December. We couldn't get a number back here.
Yeah.
We got it now.
Yeah.
But, which is great. And that number tends to stay up when you have FUE. It drops way off the cliff anytime you do a strip, because strips kill hair in the donor area.
Yeah.
So I can spot the hair loss in the crown and the middle. But when I get somebody that wants to, you know, be aggressive in the front, I say, okay, let me check if you start to lose your hair in the crown, because it doesn't look like it. And they'll be like, no, I'm not losing my hair anywhere but here. Go, well, we're going to see.
Yeah.
And then we do this evaluation and they go, buddy, you're losing your crown, you're losing it in here.
Yeah.
And by the time you're 50, you're going to be at class 5. You're going to be at horseshoe bald. Maybe you'll be 60, but you're going bald.
Yeah.
So no, we can't be as aggressive as you want to be. So every doctor should be evaluating for future hair loss, and they don't.
Oh no, I know. The first, because I've gotten 2 transplants. One from someone in Tampa that was awful.
Yeah.
It was a strip, and he went really low. And you, when I had my procedure with you, half of it was repairing what they did bad.
Yeah.
You not only covered the strip, but my hairline came all the way down, and my natural hairline was going up. So you removed a spot right here, and you told me, like, listen, I'm gonna make it look good. And I mean, it's been almost 10 years, and
Yeah.
you know,
Yeah.
and they look great. You know.
I'm glad it works
Yeah,
out.
yeah.
We're always glad to do. I mean, I know it's going to look better. And especially when people have been kind of disfigured, especially when they've been disfigured, they're gun shy.
Yeah.
They've fallen off the horse and they're a little nervous about getting back on.
Yeah.
I had one gal come in from Texas last week, and she's like, she only want to take out 3 grafts. The whole thing's got to come out.
Yeah.
She had gone to Mexico and Turkey now. You know, they're advertising heavy there. People are getting scared of Mexico. Of Turkey. They're starting to say, "Oh, maybe I shouldn't go to Turkey."
Yeah.
You know, because there is like a 95% chance that it's going to look terrible.
Yeah.
You know, and 95% chance I'm going to find a really bad doctor.
Yeah.
Well, the word's gotten out on Turkey, and so now they're coming to Mexico. And she had no idea she was going to be done by a Turkish doctor, and they just disfigured this poor young lady who just had an elevated hairline. And so we took out, I wound up taking out probably 15, 20 grafts. And she'll be back. She just wants to make sure it's going to heal, and it's not going to leave a bunch of scars. But so when they've been disfigured, sometimes they're like, well, sure.
Yeah. Well, I was when because, you know, my first hair transplant, he just wanted the money. He just wanted the money.
Yeah.
You know, so after that, I was gun shy, and I wore a hat for like a good 6-7 years, and then I said, no, I'm going to actually do my research. I got a little older, and I live in Florida. I live 8 hours away, but I chose you, and I felt lucky that you were only 8 hours away. You know what I mean? Because when I did, you were the top notch of at least my research.
Yeah.
At least my research.
Well, I mean, you know, and people, they think there's good doctors everywhere, but I can tell you, I got a torn labrum in my hip, and I'm looking for doctors. There's only 2 I'm looking at in the U.S. One of them's in Vail, and one's in New York. And the rest, there's a ton of orthopedic surgeons, but I'm gonna pick the best guy.
Yeah, yeah.
And when I get my surgery, and you know, because I don't want to be crippled. You know, I want to be able to move. I'd like to get back on the tennis court, you know, fix this wrist. I tore a ligament here when I was a high school football player.
Okay.
And one of the guys on my team made it to the NFL, and I was tackling him one day, and he took my wrist with him.
Oh.
You know, I said, he's going to make the NFL, and he did. And so I want to get back on the tennis court. Now, it's not a good surgery for this yet, but I'm bracing it now to make it where it doesn't, it doesn't hurt when I brace it. So,
Okay.
you know, then I go in and do surgery, and it doesn't bother me.
Yeah.
Whereas getting enough arthritis there would bother me. So yeah, I'm 100% with you. You find the best surgery, the best surgeon, and get the job done right.
Yeah, absolutely.
Yeah, I know there are guys out there that just say they pioneered stuff. I'm like, you didn't pioneer anything.
Yeah.
You know, I know the history of this procedure. You didn't pioneer a damn thing. And but there are pioneers, and sometimes they do good jobs, and sometimes they don't. You know, sometimes we got, you know, I wasn't the first one to do FUE. It was a guy in Australia, but frankly, I didn't think his results were all that great.
Yeah.
But the internet was causing people to want it done. I didn't expect to do FUE, but in 03, there wasn't anybody else to go learn it from. So I just sat down and figured it out. You know, and I realized that, you know, this had so many more advantages over the strip surgery that within about 8-9 months, I was pounding the table like, look, you got to learn this surgery because it offers so much better opportunity long term for your patient.
Yeah. And now no one even does strip anymore.
There are not many.
Yeah,
and if they do it, they'll sell it on the concept that you've got too much hair loss for FUE. So you know, those are the people that definitely shouldn't do a strip.
Yeah.
You know, maybe some women and maybe some people with minimal hair loss where you don't need to take a ton of hair. Maybe an older patient with minimal hair loss. But other than that, you know, there's no advantage to doing a strip. None.
Yeah.
Zero. So it's a dying surgery. Okay. But what I can remember my colleagues in 2003 and 2004 going into meetings, and they would say, am I going to have to learn this? I go, yeah, you are.
Yeah.
And then I'd walk away and they'd be together and I'd see them laughing and making fun of me. You know, like, you know, he really thinks we got to learn that surgery. That's a terrible surgery. Nobody's ever going to adopt that surgery. Now it's the most common surgery in the entire world.
Yeah. Yeah, man.
Yeah. So yeah, we're glad you came. We're glad we helped you. We're glad you responded to the regenerative medicine.
Yeah, absolutely.
Long term, it's a better solution than a hair transplant.
Yeah. Yeah.
Okay.
It's just another tool, you know?
Yeah.
Yeah, absolutely.
Well, but you know, I am a huge fan of regenerative medicine and longevity. And we got a lot of tricks up our sleeve these days. We had, and like you said, this PRP was first described in 1998. Okay, the stem cell, treating people with adipose stem cells, in 2001. Patricia Zuck, who was a researcher at UCLA, discovered there were stem cells in adipose. This whole regenerative cell-based therapy is that new.
Yeah.
It is new.
Yeah.
Okay.
No, I haven't heard much about it. Yeah. And you don't do the PRP. You.
I lice them.
Huh?
I will do PRP on occasion, but I can't deliver PRP with the TED.
Yeah.
Because the platelet's about 3 microns. Okay, I got to get something under about 40 kilodaltons. Although almost says under 1,000 daltons. Now that means I can deliver drugs like finasteride and dutasteride, which finasteride and dutasteride are like 300 to 525 daltons. You know, so they're small. But growth factors are going to be 8 kilodaltons up, some are 40, maybe even 50 kilodaltons. They'll get in. Okay, so we open a channel big enough for these things. So we have to burst the platelet to deliver it painlessly. Otherwise, we got 2 choices with PRP. And PRP works. It's just, you know, I know that the lyse platelet is going to deliver 5 times the concentration of the high molecular weight growth factors. And so this is very important. And the big growth factors will get trapped inside the clot. So platelets do a couple things. One, you get cut, you want to stop the bleeding, right? So platelets clump together and they help, stop the bleeding, plug the hole, right? And when they clump together, they release the growth factors and cytokines. That initiates the healing. Okay? So you want it. But that clot traps those big growth factors. They can't get out. So it's like a screen door. The little tiny, fruit flies can get in, but the wasp can't, the fly can't, the regular old house fly. So, but we want all those growth factors out. So what I said, well, is there another way? And not knowing that it was going to create a better outcome, I was like, is there another way? And so I read a paper by a doctor in Italy who had an ultrasonic bath. And he used ultrasound to burst the platelets. But I looked at the bath and I said, well, that's kind of like the ultrasound that we clean instruments in, which is very similar. Like, you ever seen those ultrasounds we take to the jeweler with your, you might take a ring or something like that they clean it with? That, you put your finger down in that and you can feel it. It's like nibbling away at you, That's cavitation bubbles, right? And cavitation, it's what like destroys an impeller on a pump or a propeller on a boat. So it's well-known technology. I was like, that doesn't seem like a lot of energy, but okay, if it works. So I called the guy, and he didn't return my call. So I wrote him. He didn't respond to my email. And I'm like, okay. So I happened to have a plastic surgeon from Italy who was training in my office. And I said, will you please contact this Italian doctor? So I had her contact him in Italian. Phone call, email. He never responded. And then the ultrasound that he described in his paper, they no longer made it. And I'm like, okay, if you write a paper and you're talking about using this to lyse platelets, right? And you can't buy it. Nobody can double check your results. So this is like the perfect scam paper, And I'm like, well, he doesn't want to reply to me probably because it ain't true. So I said, okay, I'm going to start at square one. First of all, I got to find something that is going to lyse a cell. And I found a company that made an ultrasound that would lyse DNA. So they were doing it to crack DNA so they could study it. And I said, oh, let me try that. So I started out on my first study. We did things to measure the concentration of growth factors. And so we compared it to like traditional activation of the platelets with thrombin, activation with calcium gluconate, which is a calcification, and then different durations of sonication. And what I found was that when I got to 30 minutes of sonication, my concentrations of high molecular weight growth factors went, they were 5 times, 6 times as high as through traditional activation. And that's when I said, okay, there's the protocol. And I published the paper. And then I discovered that it did a much better job in terms of getting grafts to regrow quicker.
Wow.
And like sped them up. Like 99% were growing at 4.5 months, versus what we'd expect around 40-50%. And compared it to traditional PRP, and in traditional PRP it was like 75%. So I was at 99% versus 75%. Okay, it's better post-transplant, and it also is much stronger when you take it in the lab and you culture. You put dermal pill on a plate, and you look at their proliferation. The higher the concentration of the growth factors through lysing the platelets, produces much better proliferation. So the proliferation scores go way up. And so, that was it.
Yeah.
That was it. But we still do some PRP just because it takes less time, and periodically my ultrasound machine, I have to send it in for repair. Sometimes, we always test it. Like I like to get your baseline platelet. I like to get the platelet count after I prepare the PRP, and I like to drive it up to, the 1.5 million range per microliter. And baseline is average is usually about 200 to 220,000.
Yeah.
So I push it up to like 1 to 1.5, 1.6 million platelets per microliter. So it's much higher. And then I sonicate it and I measure the platelet concentration in. So I evaluate the efficiency of the sonication. So if I take 1.6 million platelets and then I run a platelet count after the sonication and it's like 6,000, then that means I burst, well over 1.6 million.
Okay.
So my concentration of growth factor is going to be off the chart.
Yeah.
The growth factors, cytokines, and exosomes. So it's a process.
Yeah.
But every now and then, equipment fails and I might have to do a PRP. And some people can't wait because it's going to take about 2 hours, sometimes 2.5 hours to do a CRP.
Yeah.
And in your case, I can tell you that CRP and PRP hurt when you inject. They hurt. And I did it to myself. It hurts. And but when you do it with the TED, it's painless.
Yeah. No, it absolutely was. Yeah.
So you did good. Proud of you.
Thank
Keep
you.
Keep it up. I saw a presentation in Sao Paulo, and one of the doctors was saying that when we treat hair loss, it's not it's not one thing. And you can't give people too much. Sometimes you might want to put them on an oral finasteride and a topical dutasteride. You might want to do the exosomes. You might want to do growth factors. You might want to do, and tattoo in minoxidil and all kinds of different things. But you can't do too much. And so it's not, I can't have it all. You can have it all. And maybe that's the best way to go. So when you got hair loss, all that really matters is you got more hair.
Yeah.
Right?
Yeah. Absolutely.
Yeah. So, good. Proud of you. Good job. Keep it up.
Thanks.
All right. Stay the course.
Sounds good.
All right, my friend. Good. Congratulations.
Thank you.
ForHair is run by Dr. Cole with 30 years of hair restoration experience, and we offer the most cutting-edge technology available. In fact, the ForHair Enterprise sub-company Cole Instruments manufactures custom-made tools and automated tools for hair restoration physicians all over the world. Our quality, expertise, and skills are superior to other clinics. Our reputation and results are the best in the world. It's time to restore your hair. It's time to choose ForHair.
We hope you enjoyed the video. Don't forget to hit the little bell button to get notifications of ForHair's video uploads. For online consultation, click on the link on the screen or in the video description.